America is the richest country on earth, but millions still struggle to access basic health care. Many choose not to seek medical help when injured, while the rest choose never to get an annual checkup or to step foot into a doctor's office. Why? Because in the United States, health isn't treated as a right, it's a business. Some even compared health insurance companies to airline companies, where the rich pay top dollars just to get proper medical coverage, and average people like you and I are left with the crappiest plan that doesn't cover much, just like the economy seats. So, when you get into a car accident, an ambulance will bring you to an emergency room at the nearest hospital, in which you don't have the leisure to pick and choose doctors that are within your network, since you most likely will physically be in a bad condition or even unconscious. Then, a group of doctors at the emergency room will perform a CT scan, X-ray, or even surgery. The next thing you know, you'll be hit with 5 different bills from the same hospital, amounting to a whopping $20,000, in which you have to pay $8,300 out of your own pocket because your employer signed you up for the cheapest health insurance plan with the highest deductible. So why exactly are we paying for the monthly premium when we still have to pay for the high medical costs ourselves? Behind closed doors, health insurance companies rake in billions while patients are denied the care they need. It's a system where profit comes first and people come second. Skyrocketing costs, surprise bills, insurance plans that cover everything except what you need. Delayed pre-authorization and denial for medical care that cost patients livelihoods and even their lives.
The insurance company telling me that my life didn't matter.
For many Americans, healthcare feels less like a system to help them and more like a system to fight against. Alas, this bottled-up frustration has pushed hard-working Americans to the extreme, where some took matters into their own hands. It is mind-boggling how expensive healthcare is and how many people choose not to be insured today.
I'm actually working in healthcare and can't afford to pay it.
I actually stopped taking ambulances, really.
The majority of Americans don't have much of a choice when it comes to their insurance plan. More than 54% get health insurance through their employer.
In the United States, being sick can cost you everything. Not just your health, but your savings, your home, even your future. How did we get here? America's healthcare system isn't broken by accident. It was built this way. To serve profit, not people.
Medical establishment in this country is making everything so complicated and so unnecessarily difficult that you're just going to give up.
The US spends more on healthcare than any other country, over $4 trillion a year. Yet we rank poorly in life expectancy, infant mortality, and chronic disease outcomes. The system feels broken for everyday people, from sky-high insurance premiums and prescription drug prices to surprise medical bills and long wait times. But why? Because so much of that spending doesn't go toward care. It goes to administration, lobbying, and corporate profits. Private insurance companies act as gatekeepers. They decide what care you get, how much it costs, and whether it's even covered. And their top priority? Shareholders, not patients. Health insurance used to cost $6,000 a year. Now, it's over $22,000. Workers are paying more, even with insurance. Wages? Mostly flat. Premiums climbing fast. For many, basic care feels out of reach. Let's take a look at the story of Tracy Pike. A husband, a father, and a man who lost his life not because of a rare disease, but because of something far more common: bureaucracy. In 2023, Tracy Pike was diagnosed with stage 4 stomach cancer. Doctors knew what he needed. The treatment was clear. But before he could get it, the insurance company had to approve a pre-authorization. Days passed, then weeks. Angela, his wife, made phone calls, begged for answers, and watched as her husband's health declined. She was told it's under review. The insurance company denied the pre-authorization, not based on medical judgment, but on paperwork and policy. By the time they finally approved it, it was too late. Every day, people are denied life-saving treatments, not because the treatments don't work, but because insurers decided they're too expensive. In 2023 alone, insurance companies denied nearly 17% of claims made through ACA marketplace plans. That's nearly 1 in 6. Health insurers are also using AI to process data, which some experts say leads to higher wrongful denial rates. Companies like United Health, Humana, and Cigna are facing lawsuits over using AI to deny claims. And behind every denial is a real person. A child who can't get insulin, a cancer patient fighting both their illness and their insurance provider, a family bankrupted by a single ambulance ride. So why hasn't it changed? The answer is simple: money.
United Health Group has the highest price per share of any company included in the Dow Jones Industrial Average, and it's the 10th heaviest weighted stock in the S&P 500. That means not only is United Health Group the biggest healthcare conglomerate in the United States based on market cap and revenue, it's even bigger than JP Morgan Chase, the nation's largest bank.
The top 5 U.S. health insurers made over $60 billion in profits last year. They spend millions lobbying lawmakers, ensuring the system stays tilted in their favor. While you're fighting for coverage, United Healthcare executives are being rewarded with multi-million-dollar bonuses. United Healthcare is a giant in the healthcare world, and lately, it's been catching a lot of heat. People are frustrated. They feel like the company sees them as just numbers, not actual people. Also, United Healthcare doesn't want you to know this. But they're not just an insurance company anymore. They're quietly buying up your doctors, your clinics, your data, and turning healthcare into one big profit machine. And the scariest part? You're already caught in the middle of it.
Witty's vision, every part of this process, the pharmacy, the doctor, the loan provider, the insurance, are all run by the same company, his.
They're providing physician bonuses to their own physicians to aggressively code things and then deny treatment if possible, if they can get away with it.
It doesn't have to be this way. Dozens of other developed countries guarantee healthcare to all their citizens and spend less doing it. In systems like Medicare for All or single-payer models, the priority is health, not profit. It's not perfect, but it's humane.
Canada also has comparable or better health outcomes than the US, even though it spends less money. Canadian Medicare is a publicly funded model with private delivery. The system was established in order to ensure equity among citizens regardless of people's ability to pay. It was also created in order to keep administrative costs low.
They don't want rich people getting better care than poor people. That would be terrible. That would violate their basic egalitarian values. In America, we kind of take it for granted that a rich kid is going to get better treatment than a poor kid. That's kind of standard. In Canada, that would be taboo. That's a sin.
The question isn't whether we can afford it. It's whether we're willing to stop putting corporate profits over human lives. The government has the power to fix this. It's time to regulate harmful practices like prior authorization and establish real accountability for how claims are handled. Our health should come before corporate interests. If you're tired of a system that bankrupts the sick and rewards greed, you're not alone. It's time to speak up for ourselves, our families, and our future. The more we raise our voices, the harder it is to ignore us. The new administration has to take meaningful steps toward holding private insurance companies accountable and repairing our broken healthcare system. If you believe healthcare should be a right, not a privilege, and if this video resonates with you, please like, comment, share, and subscribe. It helps more people join the conversation and pushes this issue into the spotlight. Until then, stay informed.